All right. I'm going to make this just a little bit larger so you all can see the PowerPoint a bit better here. All right. But again, good afternoon, everyone, and thank you all for joining us for today's webinar on Runaway Youth Prevention. Today's meeting is being brought to you by the Office of Juvenile Justice and Delinquency Prevention. My name is William Moore, and I am with the National Training and Technical Assistance Center. As your technical host, I would like to take a couple of minutes to discuss a few features of the Adobe Connect webinar platform and provide a few announcements for you all to keep in mind. Please note that today's event is being recorded. It will be published on NTTAC's YouTube page. The webinar recording will be archived on NTTAC's YouTube channel, where you can also view past webinars. For event transcripts or even supporting materials, please contact the OJJDP NTTAC Help Desk. For those wishing to download a copy of the PowerPoint slides and other important documents, you may do so by locating the handouts pod directly above the chat pod. Here, you will also find an FAQ for webinar participants that will likely address any technical related questions that you may have. Simply click on the name of the file, then click the download button. There will be a Q&A during today's webinar where presenters will address some of your questions that are posed during the meeting. Please type your questions into the chat box as they arise. For those of you participating in today's webinar as a group, please take a minute to help us count. Go to the chat window and type in the total number of additional people in the room with you today. If you're viewing alone, there is no need to type anything into the chat pod at this time. And I'll give folks just a couple of minutes to do so. Again, only type the number of additional people that are in the room with you today. If you're viewing alone, there's no need to type anything at this time. Only additional people in the room with you today. And I'll give folks just a couple more seconds to do that. Following today's webinar, attendees will be sent a certificate of attendance. This certificate is sent approximately 1 hour following the conclusion of the event and is sent via an Adobe Connect thank you email. Please keep an eye out on your email for this certificate. Please note that only participants that are registered and signed in will receive a certificate of attendance. At the conclusion of today's webinar, you will be provided with a link to a brief survey about today's presentation. The feedback you provide will assist in future planning and training. I will now turn it over to our moderator, Jerome Voigt, for today's welcome and introduction of our presenters.
Thank you, William. Welcome to our webinar on Runaway Youth Prevention. I am Jerome Voigt with the Office of Juvenile Justice and Delinquency Prevention. Youth runaways and homelessness are often the unfortunate consequences that are often linked to system involvement. Research has shown that these children also face a range of challenges related to their health, emotional well-being, safety, and development. OJJDP is working to address these issues through several programs such as mentoring, drug treatment courts, reentry, partnerships, and research. This work includes partnering with the U.S. Department of Health and Human Services, the U.S. Department of Housing and Urban Development, the U.S. Interagency Council on Homelessness, and the National Network of Youth. OJJDP also has funded research to provide national estimates of missing children based on surveys of households, juvenile residential facilities, and law enforcement agencies. So we are pleased today to have this webinar on this very important topic. At this time, I will introduce our 4 great presenters that will provide a wealth of information and research on this topic. Our first presenter will be Dr. Dominique Rosepowitz. She is an associate professor in the Arizona State University School of Social Work and the director of the Office of Sex Trafficking Intervention Research. Her work is focused on using innovation to expand the knowledge base and capacity to serve victims of sex trafficking. Dr. Rosepowitz is on a number of local, state, and national expert working groups, task forces, and councils. She has also consulted on a global project using technology to address human trafficking. Our next presenter would be Liming Kong Sophie. She is a program manager within the Missing Children's Division of the National Center for Missing and Exploited Children. She is responsible for initiatives such as the development of the division's enterprise application, as well as programs of work related to children missing from care, child sex trafficking, and Project FIGHT, which stands for Federal Inspector General's Helping Team, Fighting for Long-Term Missing Children. Prior to joining NCMEC, Ms. Kong Sophie served as a tribal prosecutor as well as Deputy Director of Legal Staff Training and Deputy Chief of Sex Crimes Prosecution Unit with the Manhattan District Attorney's Office in New York City. We are also pleased to have with us today Aaron Fawcett, is a national recognized subject matter expert on the victimization of women and children through sex trafficking, child abuse, and exploitation, and has over 38 years of law enforcement experience. He has presented both nationally and internationally on the issue of domestic trafficking of children with regards to dynamics of investigative and intervention techniques for law enforcement and prosecutors. In his current position as the program manager for the National Criminal Justice Training Center, Amber Alert Training and Technical Assistance Program, and Missing and Exploited Children, Mr. Fawcett is responsible for developing and delivering training and technical assistance to law enforcement, prosecutors, social services, and child protection officials on issues related to child protection, exploration, sex trafficking, and youth at risk of victimization. Our 4th presenter today will be Susan Franco. She is the Executive Director of the National Runaway Safe Line, a national organization dedicated to ensuring that runaway, homeless, and at-risk youth are safe and off the streets. Prior to joining NRS, she served as the Executive Director of the Chicago Foundation for Education, which provides support and resources to teachers in the Chicago Public School District. She has worked with many other child youth-focused organizations over the course of her career, including Prevent Child Abuse America, Voices for Illinois Children, the Illinois Department of Human Services, the Annie E. Casey Foundation, and the Illinois Department of Children and Family Services. I would like to turn the presentation over to Dr. Dominique Rosepowitz, who will begin the first presentation.
Hello, my name is Dominique Rosepowitz, and I am excited to present to you today about youth homelessness. I'm speaking to you from Arizona, where we participate in research on youth homelessness through our work with 4 different organizations that serve homeless runaway youth, and we survey them each year for the last 5 years in a project called Youth Experiences Survey. So we are familiar with the experiences of youth in our community, and we have expanded some of our research to encompass sex and labor trafficking. That is a document that we can send out, and we're happy to share. But I want to introduce to you a little bit about the definition of homelessness. I'll talk to you about some of the research that's been done and some of the knowledge that we're gaining and some of the challenges that we face regarding just basically studying homeless youth and some of the research that we've begun on prevention around the country and some of the goals of that homeless youth prevention. I just want to let you know that I do have to sign off after I speak. I have to finish my class. This is the last week of classes for us at ASU. So I will be signing off, and Byron Fassett will be answering questions regarding my section. So I want to start with the definition of what homelessness means by the federal government. It counts for youth under the age of 25. Those youth are unaccompanied by a family member or guardian. And many of the kids that we work with are not all runaway, or were not kicked out. Many times their families don't have the financial means to support them any longer, or they didn't for a long period of time, and they were unable to remain in that community or in that home. We assume that many of the kids that we work with are kicked out, and we know that happens in some cases, but it's difficult to oftentimes differentiate between the reasons that people leave and the reasons that people are kicked out of their homes. The definition also includes living in a place that is not meant for human habitation, for example, a street, or in housing that is supplied specifically for homeless runaway youth. So shelter is transitional housing or a hotel paid for by government or charitable organizations, including some group living situations. And this can also include couch surfing, and that's something we'll talk about a little bit later when we talk about rural homelessness. It also includes those who have dropped out of school or without regular employment, are living in precarious conditions, and often have little support systems, or their communities. They don't have people to turn to as things continue to get worse. There's big gaps in their support networks. And we found in the Chapin Hall report that the rural and urban youth are often impacted somewhat differently. Rural youth have fewer resources to reach out to. They're often farther away from resources. They're more often hidden. They're more often on people's couches, which are a little bit harder to connect to and find services. For all youth, we find that in most of our interactions with them that they are hiding from something, whether they're hoping not to have interactions with law enforcement or schools or people who they think are looking for them. So serving youth who are homeless are often challenged by that element of hiding. So the research that we have seen, which is building very comprehensively, has really taught us that there are specific things that are happening that create elements of homelessness for young people. That transitioning from foster care to adulthood, we have excellent federal funding focused on this, and research is being done, but that transition continues to present a gap. In my work with sex-trafficked youth, we often see that period of time right when a person turns 18 to be an incredibly vulnerable financial time, and just not having lots of other opportunities to make ends meet and make things move to the next step of development happen. So we know that research to be beginning to have more and more validity, and we're seeing that more and more in our homeless youth. Substance abuse is something we see that is present in in our community. About 60% of our youth identify as using drugs. Almost 100% have attempted have had drug use. But abuse of substances is something that's very complicated. We see a real uptick in meth use in our community, and I know that's changing to opiates and others. But substance abuse is also something that's difficult to provide to our youth in shelter systems or in drop-in programming due to attendance, due to sometimes our clients coming in high, and some of the reasons that it's difficult to provide services overall. But addressing substance use and addiction is one of the conundrums that we face when we do research with youth. Family conflict. So in our research, we ask a number of questions, including what are some of the reasons that you were that you left the home that you were living in? And some of them said that there was a lot of violence in their home. Some said their parents went to jail or a parent went to jail. And some of them said they simply couldn't get along with the caregivers that they had in their home. So family conflict continues to be something that we see present as a push towards homelessness for these youth. Serious mental illness of parents and youth, so children who are raised in homes with parents who have variable mental health problems, as well as the youth themselves. So the vast majority of the youth that we survey who are homeless and runaway in our communities in Arizona report having a serious mental illness and oftentimes have dual diagnoses. So we're seeing our mental health systems not being very accessible to these clients. Sometimes they get good medical support, but mental health systems have not been accessible in many of the cases that we identify. History of childhood maltreatment and the ACEs scores are becoming very present in our research. We've added that to our research this year, and we understand that childhood maltreatment is often a predictor, but knowing that these kiddos are growing up in homes where abuse is around them is an important variable of homelessness. Experience of youth as survivors of trauma. Complex trauma is how we identify it in our work, but knowing that the coping mechanisms that our youth are participating in, that dissociative disorders and hypervigilance and intrusion are aspects of complex trauma symptoms that don't make mainstream work or mainstream attendance of school or mainstream integration as easy as it could be. So we know that as we address mental health problems, that addressing complex trauma symptoms is incredibly important. But those are some of the barriers that we're seeing our youth experience. Identifying as LGBTQ youth has been a constant theme in our work. We had, of the youth that we surveyed in Arizona, we had, of the sex-trafficked youth, we had 60% of them identify as LGBTQ. So we're seeing unique aspects of homelessness in LGBTQ youth. We're still looking quite hard at those determinants. There's some excellent research happening in the country on this, but we know that this is a contributing factor, whether it's about being family conflict, leaving the home, feeling not understood. There's many aspects that we continue to look at. And then family poverty, including female-led households, contribute to be a big aspect of the research that's being done on homeless youth. So some of the research challenges that we find is that it's quite difficult to evaluate success because we have inconsistent funding for many programs, so programs will start and stop, and it's difficult to follow those youth through a program that has lasted for a year but not two, and the chronicity of youth homelessness makes that a challenge. We often provide research and intervention on known groups, and those are the kids that we can find and make contact with, so we always consider that the kids that we make contact with in our community are made through known support, so street outreach, staff in housing programs, staff in drop-in centers. But there are many, many, many youth that we know that we don't have any contact with who are either couch surfing or simply unable to be seen but from the outside, so we don't know what their experiences are. And certainly the challenges of longitudinal follow-up, even if we ask for multiple ways of making contact with that person, finding relatives that we can call, many of the reasons that youth are homeless integrate into why we really cannot follow up with them over the long term. So as we address prevention of homelessness and we address some of the risk factors, the low barrier supports, some of the low barrier supports means that as youth come in, that we just provide these services. So some of the recommendations from prevention research says we should just provide these things and don't make them difficult to access. So things like mental health support can be done via Skype, they can be done off-site, they can be done in places where it's comfortable as opposed to making a client have an appointment and that appointment has to be met within 15 minutes. And some of the barriers that we create really don't, some of the sort of boundaries and framing of services don't really match the ways that homeless youth work, and so it's really important that we pay attention to having low barriers. So the things that are recommended in the research include substance abuse treatment, mental health treatment, conflict resolution, family support, and family finding. So family finding is a newer basis of research for preventing homelessness. That's finding a family member that will act as a support or a caregiver. But what we find in most of the programming that we see in our communities is that these are very difficult to integrate. You can't do substance abuse treatment in one session and many of our clients come and go rather quickly. We may see them 2 or 3 times. We may see them 80 times over a year. But it's been difficult to integrate and provide those services over a period of time. So the goals of homeless youth prevention overall from the U.S. Interagency on Homelessness Open Doors report are the focus of youth prevention, youth homeless prevention. And those include keeping kids in school, helping them finish their education for high school, so it's GEDs, but making sure that they have the supports that they need to stay in those education settings, creating and developing some sort of family support, whether it's through family finding or doing family therapy or getting families to integrate more with the supports of that youth. Figuring out what that youth risk factors are and integrating them early, So teaching teachers and special ed teachers and school nurses and youth sports persons, coaches, whoever is working with youth, pediatricians, to look for those ACEs, look for those early risk factors, and try to intervene prior to their actual homelessness. Helping youth find regular employment has become a real challenge in our country, and we know that that is a protective factor. Living in safe conditions, making sure that we have enough beds in each community for youth to have, that if they are living on the street, the preponderance of actions end up with them remaining on the street if they don't have safe conditions to live in, and creating more understanding, more acceptance, and more social support for families and communities. Thank you very much for your time.
Okay, thanks, Dominique. Love all the hellos and friendliness in the chat box, and hope everybody can hear me okay. So I am Lainey Kong Sofer, and as you can see, I'm with the Missing Children Division with the National Center for Missing and Exploited Children. So just big thanks to everybody who took the time to be on this webinar, and my short piece is just going to cover federal legislation that passed a few years ago that has had a big impact on the child welfare community, law enforcement, and the National Center for Missing and Exploited Children. So I'm also going to discuss a little bit of the byproduct from that legislation, our role in that mandate, and all in the context of missing and runaway children in care, and also in the context of one of our core missions, which is to find missing children. But before I go forward, in terms of the poll question that I think is going to get displayed, before I start to talk about this federal legislative piece, I did want to try to get a sense of the audience's familiarity with it. And you guys are so fast, it looks like you guys are already going through, but I wanted to get a sense of, how many of the audience members are in fact familiar with the Preventing Sex Trafficking and Strengthening Families Act of 2014, which I am going to touch upon during this webinar. So I can see people are pretty actively putting in their numbers, and I think, William, when we have the results, it'll just take a few minutes. We have a lot of people on this webinar, actually.
And just a reminder to our audience, you can select your answer within the poll question. Simply click on the bubble next to your answer. No need to type anything into the chat. Thank you.
Okay, great. And I think we're almost getting there, right, William? I know that we have a ton of people on, and everybody's pretty actively going into this.
Yep, looks like we're about all the way there, so we can end the poll.
Okay, fantastic. Thank you. Okay, so the poll is closed, and we have about, what is that percentage-wise, 26% who are familiar, and 45% who are not, and then somewhat. Then we have another portion of folks who are somewhat familiar with it. And then getting on to the next slide, William. So the next slide is really just a title slide, and it is Preventing Sex Trafficking and Strengthening Families Act. And so that's PL 113-183 and HR 4980, which is what we call it within NCMEC just for short, because it is a mouthful of legislation title. So for those who are unfamiliar with this act, it was signed into law back on September 29th of 2014, and it was essentially geared to improve the lives of children in state care. And we understand also in some states it's by county care. And it was really to, there are a number of different provisions, including provisions having to do with identifying and documenting and determining appropriate services to these kids in care, reporting instances of sex trafficking data in the Adoption and Foster Care Analysis and Reporting System, otherwise known as AFCARS, which basically collects case-level information, and then also using increased or getting increased information and then using this increased information collected on children in care to try to help prevent sex trafficking, and thus the title of the legislation. And the biggest piece that had an impact on law enforcement, the National Center, and the child welfare community in the context of missing children was its mandate to locate and respond to children who go missing from or run away from foster care. And so in terms of the basic mandate and timeline associated with that, the section that's the relevant one to NCMEC is where I'm putting my cursor, and what launched our internal Children Missing from Care initiative in general is really the requirement that agencies locate and respond to children who run away or go missing from foster care. And the law basically provides that the state agency shall report immediately and in no case later than 24 hours after receiving information on missing or abducted children or youth to the law enforcement authorities for entry into the National Crime Information Center, NCIC database of the Federal Bureau of Investigation, and to the National Center for Missing and Exploited Children. For those not familiar, I can see we also have a lot of law enforcement on this webinar, but for those not familiar with NCIC, it is just quickly a database that is manned by the FBI and houses criminal justice information related to and including missing persons information and including missing children. So when we talk about the mandates associated with this particular section, the legislation gave agencies a year to develop policies for quickly locating a child missing from foster care, and then 2 years before the mandated reporting to law enforcement and NCMEC went into effect. And since the passage of this legislation, state and county agencies around the country have drafted their own policies to address the missing, but also to try to prevent children from running or going missing from their care. So I just also wanted to take a pause here before I go into our Children Missing from Care initiative launched by that legislation. Prior to the passage of that legislation back in 2014, we did have and continue to have long-standing relationships with various state and county agencies who had already reported their missing children to NCMEC. However, after the passage of the legislation, in the past few years, we have seen an exponential increase in the cases reported to us. And so for anybody who is interested in data, I did want to at least share with you that in 2017, we did receive more than 27,000 reports of missing children, and the majority, the highest percentage were the endangered runaways. And we also saw that there was a big intersection between those who were in care and those who were likely sex trafficking victims. And so of the reports in 2017 of the runaways reported to us, we did see that 1 in 7 were likely victims of child sex trafficking. And again, that intersection between those in social services care when they went missing and the likely victimization by child sex trafficking was a very big 88%. Okay, so I have another poll question, and I just wanted to get a very quick sense of how many audience members have worked with us before. And you guys are really quick with the poll. And so this is not a full resources webinar, and we do have a really incredible diverse audience on here, probably with a really wide range and exposure or work with us. And then while you finish this poll, because I think it'll take just a few more seconds, I'll just at least share with you that we were created back in 1984, and we are a nonprofit organization. We are not an investigative agency, and again, there are a lot of law enforcement agencies who are on this. We are a national clearinghouse, and we provide assistance to law enforcement as well as parents, legal guardians, caseworkers, social workers, and we are partnered with the Department of Justice and many other stakeholders, and we perform 22 specific duties related to missing and exploited children. So we've really grown also, so our caseload has grown, but we've grown exponentially as well since we opened. And William, do you think that we are ready to close the poll?
Yes, I'll go ahead and I'll end the poll. Thank you all for answering the poll question.
Great, thanks.
Okay.
So it looks like the majority have not worked with us. I would imagine that many are familiar with us. And again, this is not a full resources webinar or part of it, and the next couple slides that I'm going to go to will just talk about the Children Missing from Care initiative that we launched after the passage of the legislation. I did want to show you, when we get back to it, to the PowerPoint slide, is our microsite. So I did want to give some insight into our Children Missing from Care initiative that followed the passage of that legislation. We created an internal working group, and it was focused on the Children Missing from Care program. We did a lot of outreach to establish contacts with every state social service agency around the country, and to include Puerto Rico, Washington, D.C., U.S. Virgin Islands. And we also created a new method, and a very fast online method of reporting missing children cases to us by caseworkers and social workers. And here now what is displayed is a specialized microsite that we also created as a part of this initiative, which is located at cmfc.missingkids.org. We wanted to make accessible a lot of our information to social service agencies regarding children missing from care, what our resources are. So after this webinar, if you have any questions, please feel free to go on this microsite, and you'll see that there's a home page. There's also a thank you from John Walsh, and you will also see a number of different tabs that host a lot of different information regarding our resources, what to do if a child in care goes missing. We have one specific to child sex trafficking, and other resources that we really wanted to put out there for caseworkers and social workers who were going to report a case to us, and our process and information about us was new to them. And on this microsite is that online reporting portal that we did create for caseworkers to be able to report to us a missing child case, and we've recently opened this up to law enforcement as well. So this is our public-facing microsite that we created specifically for this. And when we were given the policy mandate aspect of the federal legislation, we were aware, and I did note before, that state and county agencies around the country really work to create and implement their own policies and incorporating concepts from HR 4980. And so in response to this understanding that, agencies were creating their own policies and were likely we're likely needing a little bit of guidance, and we did get some outreach from agencies about policy recommendations. So we created this policy recommendations section on that microsite. And so as we talk about prevention for this month, here are some provisions that are specifically geared towards prevention. It's to try to minimize or eliminate circumstances that might contribute to a child going missing or wanting to run away, and that is exactly what the federal legislation was also trying to target. And so we are, in most part, we do react to the missing child cases, but we have efforts internally with our case managers in conjunction with our victim services support to also try to contribute to preventing runaway children, and not just those missing from foster care or care, but in the biological family context as well. So my time is up. Wanted to give a big thanks to everybody in this audience, and then hand this over to Byron. Thank you.
Thank you, Leamy. Hello, everyone. First of all, I want to say good afternoon, and definitely thank you for all participating, and hope everybody's enjoying this. It's always a pleasure to listen to Dominique and Leamy. As long as I've been doing this, I always find I learn just a little bit more. So definitely thank you to both of them. As an overview of what we're going to talk about here, what I want to do is really build on the information that Dominique and Leamy provided and take it to what I've referred to as that system response. The research it is what guides us on how to have that response. And the research is very, very good. It makes it very clear how our response works. But does that actually always translate down to what I would refer to as the street level? And those of you that heard me speak before, I always talk about the 2 a.m. rule. What are we doing for these kids at 2 o'clock in the morning? And so I really want to talk about that response and how that fits into the whole prevention aspects here. And part of that is truly taking that research and understanding the runaways. And by understanding those runaways, truly having that victim-centered approach on this and understanding that correlation. They're not just runaways, and that correlation between runaways, victims of sex trafficking, and victims at child kidnapping victims. And then, what does an effective response look like across the system? And how do we implement that effective response? So that's kind of where I'll take us here in the next 10 or 15 minutes as we take this and really build upon the great information that we've already been provided. Right off the bat is what I call those runaway facts. Each and every time a child, and the research is very, very clear on this, that each and every time a child runs away, their victimization, each and every time they run away a little bit longer, they're going a little bit farther. And their victimization, or the opportunity for them to be victimized, increases with each and every runaway incident. And part of that is also expanding on that term victimization. What does that look like? And one of the first things I always say I put 2 rules on this. Rule number 1, children are not running to something. And the reason I put that very negative word, they're not running to something, is oftentimes, people will say, well, we can't do anything because they're running to something. And I really think that's a way to kind of marginalize the runaway, but also in some way kind of give us almost an excuse like, well, we can't do anything. But rule number 2, I think, is an important one. And the rule number 2 is what we have to focus on. Children are not running to something. Children are running from something. And I think what we have to do as a system, and what we are seeing happening across the country, is we're truly understanding this concept. And we have to focus on the from, Because when a child comes in for services from the street, when we in the system identify them, we have to really understand where they're running from. And as a system, can we help them resolve what they're running from and to help work on that? Because if we can actually do that, then what we can do is if we can correct that problem, maybe we can't get them back home. But if we can correct the problem, we want to prevent that next runaway that may come up across the board. Hey, William, can y'all still hear me? I got a connection lost. I don't know if it's my computer or...
It may be just the virtual platform, but your audio is still connected and you're coming in loud and clear.
Okay. Well, luckily I have my slide deck up, so because I can't advance a slide here. Can you try advancing to the next slide for me?
Yes, and just go ahead and let us know when you're ready and we can advance the slide for you.
I'm ready. I'm ready.
Okay, slide is advanced. Thank you.
Yeah, I'm not seeing that, but I'll tell you what, I'll run mine over here on the side. This is what happens when we go live, isn't it? Okay, I got mine up here and I'll just kind of talk and we'll make it look that way and nobody knows the difference. So, the next slide there that you have on that is perceptions and changing those perceptions as they relate to runaways. Runaways are sometimes referred to as voluntary missing out there. It's a term that's widely used, but sometimes it misstates what's going on. It actually, I would say sometimes that term can minimize the complexity of what's going on as children that are on the street. As Dominique so well illustrated, children go out there for a multitude of reasons. I always kind of group it all into trauma, and trauma takes many forms. It can be from that intense family conflict, physical, sexual abuse, emotional abuse. Maybe they feel like they have to protect themselves or they have to protect a sibling. So that term, sometimes voluntary, can, if we're not careful, can actually marginalize a little bit. And all that kind of goes to kind of changing our perceptions of who runaways are and what they look like. And part of that changing that perceptions, we have to truly understand the costs associated and the ramifications associated for not adequately having a very, very effective response for runaways. Obviously, the first one is we want to make sure that we look at what is the cost for the child, and I'll talk more about that. But, also at the same time, and that is the most important issue, the child, but what is the cost for the system? What is the cost to society when we don't effectively deal with them? And I make a statement, pay me now or pay me later. I sat on the board for the Frederick Douglass Foundation for a while, and I think they just put me on there because I was messing up the statement, but I truly believe in his statement. Better to repair the child than reform the adult. When we don't effectively deal with the child, sometimes we set them up for failure, and that becomes an enormous cost on the system and society, not to mention the cost for the child. Can we move to the next slide, William? Okay,
we're on the next slide.
Okay. And so when we look at that, talking about those threats to the kids when they're out on the streets, when you have a runaway and that term that's out there, the throwaway, the unaccompanied minor that's out on the streets, one of the challenges we have, and sometimes it comes to perceptions of the systems, and that's what we train to really understand who these kids are. I always make the statement, that a child cannot exist on the street. And sometimes from a system perspective, if we take a 10 or 11-year-old child that's a runaway, and then we also have a 15-year-old child that's a runaway, the system will always default to that the 10 or 11-year-old child is at more risk than the 15 or 16-year-old child. And I would argue both are children, but I'd also argue that sometimes the 15 or 16-year-old is actually more at risk because, when you have that 10 or 11-year-old child, the system sees them as so young, they need protection, and rightfully so. But when you have that 14, 15-year-old child out there, they feel they can handle the situation, and sometimes mistakenly the system says, well, they can take care of themselves. And the reality is neither one of them can. Neither one of them can rent cars, rent hotel rooms, get jobs, open up savings accounts. They can't do those things that you have to do to be independent in life. And at the end of the day, they have to depend on adults. And, the problem with that is, when they have to depend on adults, sometimes with our society, there's not, there's a cost associated with that. And sometimes that cost, the only thing they have to offer is themselves and that cost. So they get out there, they may start associating with some of the street gangs that might be out there. They can creep into criminal conduct across the board. Then we also have the dangers, especially with the cell phones out there now, the social networking sites that lure kids, pull them away, and pull them out to the streets, which, all this can lead to the sex trafficking, the forced labors, and things of that nature. Can we go to the next slide, William?
Okay, we're on the next slide.
Thanks, sir. I'm doing a reboot on my computer while I talk. Threats to runaways and throwaways that are out there. I built this slide to really kind of show and bring it all together. What's that old philosophical statement that's out there? When a tree falls in the woods, does anyone hear it, or however that goes? You have a child that's a runaway out there. And when they're a runaway, they get out on the street. And if we don't have intervention, if we can't help them find a safe, secure place, then, not that it happens every single time, they start going down that pathway across the board when that happens. Making it a little bit bigger, they're looking at it is, that chronic runaway. You have that, remember I said early that the research shows that every time a child runs away, they run a little bit further and they're gone a little bit longer. Well, they start getting out of that safety area. So you have those kids on the street, you have that fear, that hunger, that shelter. They just want to be taken care of. That's where the exploitation starts. And, once they get into that, and especially when we talk about the long-term missing, what's happened to these kids? Did they get pulled into trafficking, moved across the country? Everybody's lost contact. Were they abducted? What's the difference between an abducted child and a runaway child? As when I was running my investigative unit, several of our abduction cases, several of our trafficking cases started off with a child as a runaway, but then they were abducted. Can we move to the next slide? So what are the best practices? Thank you, William. What do the best practices look like on this? We have to, again, start by framing and focusing, and I view this as a basic human rights issue. And when I say a basic human rights issue, that everybody deserves our best services as a system. Everybody deserves equal protection under law. Their prior conduct, the perception, no matter who you are, that should not impact that result. And we have to really, again, as I talked about, changing that focus, and we have to leverage those resources across the board. The community and system response. We have to have a coordinated response across the board. We have to have the training that is offered, and we do a tremendous amount of that through the Amber Alert Training Technical Assistance Program, is offered training for those first responders, your patrol officer, medical, your social services, juvenile department, your NGOs, your NPOs that are out there, your street outreach. We all have to be working in a coordinated response in unison. I use a statement, we got to make the invisible visible, because oftentimes our runaways are out there, they want to be invisible. They think they need to hide. So how do we have a proactive approach? How do we get off our heels instead of just waiting for them to come to us? How do we get on our toes as a system? How do we go out there and find our victims? And then, that public awareness. Can you take me to the next slide, William? Are we there?
Yes, we're there.
Thank you, sir. So, part of that coordinated response, and William, could you give me like a 2-minute warning since I can't see the screen?
We're right at about 2 minutes right now, so we're good to go. You have about 3 minutes.
All right, perfect. Thank you, sir. Part of that coordinated response is, law enforcement and our Department of Family and Protective Services, Child Protective Service groups, they're going to have the greatest opportunity to come in contact with these victims. And when they come in contact with them, it is incumbent, and that's why that coordinated response is so important. It's incumbent that once that contact is made, other parts of the system must engage the victim. And I really liked Dominique's slide, what she called the barriers. Sometimes we have things out there, but it's not about trying to necessarily force a child into it, but providing the opportunities for them to engage them, into the process to see if we can't, again, focus on what are they running from and can we find resolution to that across the board. If we can move to the next slide, William.
Okay, we're there on the next slide.
Okay. And so part of that coordinated response and what we're moving to across the country is, we've developed the multidisciplinary team approach for child abuse. Through various OJJDP programs, we are providing a tremendous amount of training out there on developing a multidisciplinary team approach for sex trafficking. Well, at the same time, we need to also be thinking about a multidisciplinary team approach for our runaways. Now, some of you say, and I'll use Dallas as an example, when I first started developing this in Dallas, people would say, well, you've got 7,000 runaways a year. It's impossible to do that. Okay, but what if we focus on that chronic runaway? Knowing what all the research says, what if we focus on a chronic runaway? Could we develop a multidisciplinary team approach to provide extra services, no matter what system we're in, to help that child? And that can lead to the prevention, the investigation of their exploitation that might occur when they're on the street, that aftercare, the intervention, the recovery part of it. And by doing that, not only can we curb future victimization, but maybe curb those runaway incidents. And by doing that, because we do know sometimes these kids, just by having to live on the street, will engage in criminal conduct. So if we can prevent it on the front side, then maybe prevent the exploitation and or the delinquency that might be out there across the board. And by having that multidisciplinary team approach, which is, again, it's a relatively simple process to think about. And some people say, well, it's too expensive. You can do it with zero funding. We already have all the components in place out there. We train our patrol officers. We train our frontline CPS workers. And we take our existing system components, and even if we have just an informal response, and what I would urge everybody out there to do, everybody listening out there, no matter what part of the system you're in, think about that one child that you know about, that one child that you know that's a chronic runaway, and you just make a decision today that you're going to focus. And we always have a statement, where I live in Dallas, Ross Perot's a big person. So we always say, pretend it's Ross Perot's child. Every child deserves our best services. So if everybody in this group, we have over 500 people out there, if everybody thinks about that one child within their respective system who's a chronic runaway, who has all this exploitation going on, and you're going to really focus on that child, finding that child, trying to get them into services, in a perfect world, we'd be successful in all of them. But my experience is when we apply that focus, we'll be successful on half of them. And then if we do that each year, we'll start slowly developing those models and those techniques across the board. Anyway, I definitely want to thank y'all for the opportunity and to share a little bit about this. I'll be here for questions. I'm sorry for the technical difficulties. When I turn it over to Susan, I'll see if I can quietly get my computer rebooted, but I'll be on here definitely listening. Thank you very much.
Yeah, thank you, Byron, and appreciate that. Yes, just reboot, and then we'll go ahead and get you back into the system with no problem. For folks on the phone, we do realize that some of you may have had an outage on the webinar. Just simply reboot your computer or reconnect, and you should be able to join the virtual platform. Okay. Thank you all, and now I'll go ahead and turn it over to our final presenter, Ms. Susan Franco. And Susan, you may be on mute if you're speaking right now. All right, just wanted to connect to see if Susan is able to hear me okay. Okay, just give us 1 second. Susan's running into a little bit of technical difficulties, but we will go ahead and get her squared away. Just give me 1 second. While we're getting Susan squared away, just wanted to check in. Jerome, are you there on the line?
Yes, I am.
So maybe we can go over a couple of questions that have come in while we get Susan taken care of, maybe related to Dominique and to Byron and to Lemi's presentations, and we'll get Susan squared away while we maybe go over a few questions.
Absolutely. So we do have a response to the first question that came in, which I will read. The first question was a participant wanted to know the first age children do run away.
Can everyone hear me now?
Yes.
Hello?
Yes, we can hear you.
Are you okay? I'm sorry. I completely lost my connection. Do you want me to let you go ahead and answer that?
Yeah, let me just answer the first question, Susan,
Okay.
if that's okay, and then we'll come right back to you, if that's okay, William. So the first question was the participant wanted to know the first age do children run away, since the age of in a question mark. And the response that we received to that from one of our presenters was, this is Dr. Dominique Rosabowitz. She responded, in the homeless youth research, we include 12 and over, but there have been cases of children running away earlier than that. There is some separation of services for 12 to 17 and 18 to 24-year-olds considered. I'm sorry. I think I lost the. Oh, okay. There is some separation of services for 12 to 17-year-olds and 18 to 24-year-olds to consider as well. So that's the answer to the first question. So let us circle back out, William, if you want to jump in, but I think Susan is ready for her presentation. And we do see all the questions coming in the Q&A pod that we will follow up with after this presentation.
Well, thank you very much. I am thrilled to be a part of this afternoon, and just to echo the other presenters saying thank you to all of you who are participating and listening and sharing your questions and thoughts as well. I know that we were addressing that first question about the age of runaways, which I have a little bit of additional information a bit through my presentation, which I'll be happy to share some information as well. But just to reiterate, my name is Susan Franco, and I am the Executive Director of the National Runaway Line. We are based in Chicago, and so that is where I am speaking with all of you from today. We are the federally designated national communication system for runaway and homeless youth across the country, and focus as our mission on ensuring that America's runaway, homeless, and at-risk youth are safe and off the streets. And so essentially what we do and how we do that, and I'm going to spend my time today sharing both some specific information that we have about the nature of the youth who reach out to us for crisis intervention and services, because I think it will help lend itself well to some of the additional conversation regarding prevention and intervention, but also make sure that folks are aware of the services and the role that we can play in being a partner and part of the continuum that Byron had referenced earlier, and hopefully is a good resource for many of you who are participating in this conversation as well today. As the National Communications System, we operate 24-hour services, 7 days a week, 365 days a year, and we do that via a 24-hour crisis hotline, which is the 1-800-RUNAWAY number, as well as via a menu of online services through 1-800-RUNAWAY.org, which includes an interactive live chat, which is essentially a messaging system, a crisis forum. We operate an email, 24-hour email system, as well as texting. But in terms of who we serve, we are predominantly focused on serving 13 through 21-year-olds. Again, we take and field calls and outreach from across the country. We do, however, often get callers and outreach from youth who are younger than age 13, and we also do work quite a bit with young adults who are up to age 25. And then I do want to also emphasize that we are specifically set up also in the capacity to work with youth and their families, as well as providers, to provide resources and information. And I'll get more a bit down the line in the presentation into the more specifics around what we do and how we do it. I realize now that this slide is showing up as pretty small, but what I do want to note is that toward the end of this week, we are going to be releasing a 10-year data trend report that highlights what we have taken a look at, who is calling and who is reaching us in terms of a need for crisis intervention. So what does the population of youth look like over the past 10 years who've reached out to us, who are considered runaway, homeless, or at risk for being runaway and homeless? So when we release this data report, that will also be available with additional information. But just to give you a general sense from what we have learned, when we take a look at just 2017 overall, on average we're reaching about roughly 90,000 youth via different crisis connections. What we have gone to is defining our services as crisis connections, because we no longer just operate our 24-hour crisis hotline, but also those digital services that we talked about. What we do know, and I think that this is a helpful piece of information, is that when we look at where youth are when they are reaching out to us and when they are in need of our services, we know that about 57% of the youth who do reach out to us have not left home necessarily. They are calling either from home or from a friend's home, but they are in crisis, but they have not necessarily at that point decided or made the decision to run away or to leave the place where they are currently staying. We do also know, and this I think echoes some of what Dominique stated in her presentation, that 33% of the youth who do reach out to us indicate that family dynamics and difficulties at home are really what both prompts them to reach us and both prompts them to consider leaving home. In addition, what we are finding when we look at that trend report is that over the last 5 years, again, keep in mind that this is taking a look at not the overall runaway and homeless youth population, but the population of youth who are using the National Runaway Safeline services. We've seen over the past 5 years a 65% increase in the number of youth in crisis who are reaching out to us and who are experiencing some form of abuse and or neglect in their home. We are also seeing a pretty significant uptick over the past couple of years in where transportation is one of the issues that is a significant prompter for youth to reach out to us for help. It may be transportation to get from home to somewhere else where they think they will be safer, will be a better option for their living situation. It may be that they have left and made their way to another community or another city, and they're looking for assistance to get elsewhere, again, where perhaps they have a family member or a friend or an option for somewhere where they may be able to stay. This next slide, I realize, actually repeats a bit that we talked about in the beginning, but I just do want to note that over the course of the last 10 years, we have seen a 42% increase in the number of youth who are reaching us while they're still at home or in their current living situation. What this indicates is a really significant, we feel, opportunity to really take a look at prevention and early intervention opportunities in in regard to the fact that youth are in crisis and they are reaching out for help and for options. And so this, for us, is a way that we are really taking a hard look at what are those options out there and how do we make sure that we're building the right kinds of collaboration and access to resources to focus on that prevention component. We've seen a pretty significant decrease in youth who are reaching us as a result of a connection with police or law enforcement, but also over the past 10 years, we've seen a significant increase, 42%, in the number of youth who are reaching out to us and are living on the street and are at home. I'm going to, just in the interest of wanting to get to a few other things, I'm going to skip over a few of these slides because you have access to them and can certainly peruse the information. I know that there were some questions in terms of what is the age of youth who are running away. Our data, this has been pretty consistent across the board over the last 10 years or so, is that, which is no surprise, the majority of the contacts that we receive, 74% or so, are from youth under 18 years of age, but we are also seeing quite a few, 26% contacts are between 18 to 21-year-olds. The average age for us of a youth who reaches out for crisis intervention and support is going to be 17 years old. When we look at the demographics of who's reaching out for crisis intervention and support from us, we are predominantly seeing young women who are reaching out at 69%, but over the last several years, we have seen a significant increase in the number of young men who are reaching out. We've also, which again is no surprise and in line with some of what the other presenters have talked about, there has been an uptick in the number of youth who are consider themselves transgender or gender nonconforming. So I want to make sure to talk a little bit more about the services that we provide through the National Runaway Safe Line, in the hope that we can certainly be a resource to all of you as well. As we look at the services and the crisis intervention and support that we provide at the National Runaway Safe Line, we're very focused on our being a confidential resource for young people, that we are non-judgmental and non-sectarian, and we are very focused on a trauma-informed approach. We very much take the youth through a process where we help them to really we listen and take a look and really focus on what that youth has identified is the issue that they would like to address, and then how do we help them come to a solution-focused outcome. And then really one of the key things that we really I think offer and provide in this arena is that we manage and oversee a database of about 8,000 plus resources that cover nationally. So a youth who is calling us really from anywhere in the country, what we're able to do is utilize this database, be able to then, the goal is always to link a young person to resources that exist in their own community or to help them access the closest resources that are available. What I want to also kind of talk about is, and this slide gives you a general list of some of the range of kinds of, actually I know this is a little out of date, but gives you a general sense of some of the topics and some of kind of the content that we're able to address. We get calls not just about youth who are calling because they're considering leaving home or running away, but who are on the street and are looking for, again, a myriad of resources and access to services that they may need. So this is just a sampling of some of the issues that we're both able to discuss with them, but then also connect to resources in their community. We do offer, through the National Runaway Safe Line, a message relay service. What that allows us to do is to help provide a connection between a youth and their legal guardian. This relay service, it has to be initiated by a youth, so they can call us at the National Runaway Safe Line. They want to sort of feel out the waters and reach out to see what options may be for potentially returning home or making a link back with family members. They're able to leave a message with us that we're able to then relay to a parent or guardian. We really work with the youth to make sure that it's a message that will help sort of facilitate a potential open the door for further communication. We then are able to relay a message back from a parent or guardian if they choose to do so, but the youth does have to call us back or reach us via email or online in order to receive that service. But what we find is that this is a really early way to make some connections for youth back to their family. We also do offer conference call services, which is a way both for an intervention option as well as a prevention option. So when we have a youth who is still at home and they're having difficulties with a parent or guardian or another family member, we do offer this service where we will do a three-way conference call and mediate that call with the young person as well as the adult that they are looking to mediate that conversation with. Again, working to try to bring some resolution and offer some solutions and access to resources and options with the focus of helping that youth remain at home. Another key program that we offer, we work with Greyhound Bus Services and operate the Home Free program. Home Free program is essentially a free transportation system where we are able to facilitate access to a free bus ticket for youth ages 12 to 21. When we are looking at providing the service for 12 to 17-year-olds, we are facilitating a return home to a legal guardian or a parent. There's a lot of effort and a lot of work that goes into facilitating that return home. I know there were some questions about what if returning home is not an option. This is where there's a lot of conference calling back and forth. There's a lot of dialogue with parent or guardian as well as the youth to ensure that it is a safe return home. And then for 18 through 21-year-olds, what we're really finding is this is a way for that youth who wants to return either back to their home community or to a place where they have family or support system and feel that we're able to both get them there and then link them, again, to really helpful resources in their own community. What I also just want to focus on, and I know I'm sort of close to the end of my time here, is that while we predominantly focus a lot on our crisis intervention and our support services and resources we're able to directly offer to youth and families, we also do have quite an extensive menu of online resources, both focused on crisis intervention and support as well as runaway prevention. All of those resources are available on our website. And then we have a runaway prevention curriculum called Let's Talk, which is all accessible and downloadable on our website. It is a 14-module curriculum. This just highlights the different modules and topics that curriculum covers. Each module can be downloaded and utilized separately so that this is a curriculum that can be used in many different ways in many different settings. And we also have staff on hand who are able to help facilitate that and help facilitate ways to implement and utilize this curriculum, again, in various settings and how to help train on this curriculum. And so I think with that, I am out of time. So thank you so much for the opportunity to share this information with all of you.
Great. Thank you very much. And so now we are at our portion where we will do the question and answer for our audience. I just want to confirm to make sure that we didn't lose Jerome. Jerome, are you on the line by any chance?
Yes, I'm here. Thank you.
Okay, great. Excellent.
So it's wonderful that we have several questions that have come through the chat feature. So I will read the questions, and we have our presenters here that will respond to the questions. So hopefully you guys can hear me well. We answered the first question, so we're moving on to the next question. Do local law enforcement agencies automatically report runaway youth to NCMEC, which is the National Center for Missing and Exploited Children? That question, I believe, Limi, would you like to take that?
Sure, thanks. So Local law enforcement does not necessarily automatically report all of their runaway youth to us. In the context of those who are in state or county care, that federal mandate does not cover law enforcement as a mandated reporter. We do usually see reports in that context from caseworkers or CPS investigators, and then we do receive reports from law enforcement. If there are duplicates, then we can handle that. And then really incidentally, the entry of the child into NCIC, sometimes people mistakenly think that just because a child is entered into NCIC and a report is made to law enforcement, that somehow automatically translates into a report with us, but that is not in fact the case. So for any caseworkers, social workers out there, we encourage you to report to law enforcement, get the child entered into NCIC, and then to us. And then similarly, we encourage reports from law enforcement in terms of runaway youth if somebody hasn't already reported it to us. And hopefully that answers your question.
Also, from the National Runaway Safe Line, if we have a parent or guardian who reaches out to us to ask what they should do because their young person has run away and or are missing, we do walk them through a series of things that they should do, including the steps that were just referenced. But we also have a relationship with NCMEC, so it's one of the things that we, when we have a call of that nature from a parent, where we automatically suggest and refer them on to NCMEC and often actually directly transfer that call.
And so with that, Susan, would you like to take this question? I believe based on your experience, you may be able to answer this one. What have been some tools and best practices to teach coaches, teachers, et cetera, to identify ACEs in youth?
So I know that there are a lot of good resources out there on identifying ACEs, which are really the different indicators of trauma. I would probably feel more comfortable if I were able to just follow up somehow and to provide some actual resources rather than speak to that directly, just because that is not, again, there's some really good tools out there. I just don't have them right.
No problem. And we can follow up with additional resources with that. So the next question is, how are juvenile justice agencies being trained to identify runaway status offenders who are victims of abuse and sex trafficking? And I think, Byron, you're going to tackle that question for us.
Yes, there's a tremendous amount of work going on right now through assessment tools. So when a child is recovered on the street, whether it be somebody who we think is involved in trafficking or a runaway, the assessment tools are being used, and they're being developed as we speak, but a lot of them being used within our juvenile justice systems, within our law enforcement agencies, and also within our Department of Family and Protective Services. And the encouraging news there is we're not just looking at them as runaways anymore. We're definitely seeing the correlation. You know, when I talked about, children are running from something, we definitely see that correlation. So they're moving into, and you probably heard me during my presentation, I kept referring to runaways as victims, and that's where we have to take our mindset. I've heard several of my co-presenters talk about a trauma-informed approach, a victim-centered approach. And so the assessment tools are our biggest tool out there. Which I'll just say is time. Spending time with that child, talking to them, why are they running away, and seeing if we can't, make a bridge in there to have some type of resolution to them.
All right, thank you for that. Is there an alternative option for the runaway other than being returned to the home if they are not wanting to go home? I'm not sure which one of our presenters would like to tackle that question, or maybe you have a response to that.
This is Byron again. Yeah, this is Byron again. I look at my panel, so I'm probably the one that will take this. Yes, there are alternative options. And again, going back to spending time and talking to them. So when you have that child, home is not always the best place for them to go. especially, if we don't understand, again, I keep going back to what are they running from? And the only way we're going to know that is through those assessment tools, by spending that time talking to them. And when we spend that time talking to them, by default, that's the old traditional way of doing it. You find a child, you take them, you drop them at home. I mean, I can use Dallas as an example. We have a high-risk victims model. So if you run away 3 or more times, we remove choice from everybody. You are now, under the high-risk victims model, if you run away 3 more times, when you're picked up, and every officer is trained in this, then a special team of detectives, we have what we call a rapid response team. Detective, caseworker, child protective service, and a coordinator come in and talk to that child, what's going on in their life, what is the best options out there for that child. Home may be that option. Maybe it's home with an advocate going out there with them. It might be we need to bring child protective service into the mix here. But, you have to look at this holistic approach instead of you're just a runaway and we're going to put you back home, only to sometimes put them right back into a very horrible environment. So hopefully that answers that question.
This is Susan from NRS. I also just want to add, when a youth reaches out to us and they indicate to us that being at home or going home is not a safe option for them or a choice for them, what we really do is help them walk through and think through what are the variety of options then that may be out there, whether it's a family member, whether it's a friend, whether we really spend the time going through our database of referrals and resources and help them find a runaway homeless youth program that may be an option in their community. There's such a good, strong network of runaway and homeless youth programs across the country that we will help link them to as well. When we are doing that, we're not necessarily just saying, here are a couple of shelters or a couple of different programs, good luck. We're often helping to facilitate conference calls to make sure there's a bed, and to find out if it's a good fit. Is it a option that's LGBTQ friendly? Is it a program that's friendly for a parenting teen? So that is definitely one of the things that we spend quite a bit of time reviewing and helping to really have that youth leave their conversation with us with a plan of action in place. The only other thing, I just wanted to go back to the earlier question about any resources on ACE and how to look for indicators, not to take us off track. But the CDC, so the Centers for Disease Control, has some really good resources, as well as there's actually on the SAMHSA site, which is the Substance Abuse and Mental Health Services Administration site, there's also some pretty good options on there, as just an FYI.
Okay. Thank you, Susan. And real quick, I do want to let everyone know, all of our attendees today know that all the questions are being recorded. And I know we have so many pouring in, which is great. So even if we don't get to all of them, we will have follow-up from the presenters. And again, the webinar is being recorded, and we will have information posted even post the webinar. But I wanted to follow up because I saw one question come in, Byron, and it was about when you said being picked up, did you mean being picked up by law enforcement? So I want to circle back to that question. And then I just want to also, I think going back to Susan, there was a question about, Susan O'Brien, if you can answer this, when are you considered a runaway? What's the time frame? How many hours? So maybe we can get to those two questions. That might be helpful, because I think they relate to what you all were just talking about.
Okay. The first question I picked up, can you restate the question more specifically?
I think in your last comment, you said picked up. I'm sorry, I'm trying to read the question. What did you mean by being picked up? Do you mean the youth being picked up by law enforcement? I think it was a clarification around the comment to your question.
Yeah, when we say picked up,
do you mean make contact with law enforcement?
Yeah, when law enforcement, picked up, recovered, when law enforcement comes in contact with let's say at 2 o'clock in the morning with a child on the street, and they're a runaway, they have a duty and a responsibility to protect that child at that point. So yeah, so when we say picked up, we're talking about when law enforcement finds them, or if CPS gets called out to a hospital, maybe a child's presented at a hospital. It's all about where they present. But what you're going to find is, again, they're out there on the streets. Your first responders within law enforcement, your fire department, your CPS workers, and we have our street outreach people. They're going to have the most contact with these young children, these victims. And so when we do find them, quote, pick them up, we got to make sure that it's a very victim-centered approach, and we don't just treat them they're a runaway, take them home and drop them off, that we take that next step to determine what's going on and why they're running.
Okay, thank you. And can we follow up on a question? Is there a common definition of time that's considered for a runaway? 1 hour, 6 hours, 24 hours?
So this is a very common question that we field both from youth and from parents, as well as the question about, is it legal or illegal to run away? So typically, again, it varies for a youth who is in the system versus a youth who is not involved in the system, who leaves home without permission or leaves as an unaccompanied minor. It is not illegal to do that, is what we explain to a youth. It's considered a status offense. But in terms of the definition and the age or the time frame, in terms of the age of when you're considered runaway versus an adult, unfortunately there's not a simple answer because it's going to vary by state. So different states have different ages for the age of majority. So what we will typically do is help a caller look up and say, okay, you're in Alaska, so this is what the age would be if you're considered a runaway versus an adult who's left home. In terms of the time frame, a lot of that has sort of gone to the wayside. There's not any longer sort of you have to wait 24 hours or 48 hours to make a report. What we talk with the parent about, if they are calling and asking what they should do, is that they should go ahead and contact friends and family, contact their local police department, and then from there, again, a lot of this depends upon the relationships and the response at the local level. I know that's not a straightforward answer, but there is not a sort of national, federally sort of designated, after this much time, a youth is considered a runaway.
Thank you. So more looking locally. Appreciate that response. So again, just in the essence of time, I'm going to try to get to 2 more questions. And this question is, how can we avoid getting juveniles involved in the juvenile justice system when they are victims of abuse or trafficking rather than being charged as a runaway? I'm not sure who wants to take that.
This is Byron.
Your question? Yes.
Yeah, I'll be happy to take that. Again, it goes back to everything I'm saying. If we go and look to the past, we know how to change the future. And oftentimes children that are runaways out there, they were just picked up and taken home. By changing the optics on this, the view of them, and when they are picked up, investing that time and talking to them, that's how we're going to find the abuse in home. That's how we're going, again, I keep talking about what are they running from? And I can talk about from my own personal experience, when we started a high-risk victims model, we only focused on talking to runaways. And over 6% of them, from just talking to them, we were only finding in Dallas, when we first started back in 2002, we were only finding maybe 10 to 12 girls a year, children that were involved in sex trafficking. That was only from a vice arrest. But when we started investing the time and talking to the runaways, we went from 10 or 12 a year to literally 250 that were involved in trafficking. And it's only because we spent that time talking to them. So again, I know I sound a little bit like a broken record on that, but that first contact with them, identifying Again, I'm talking about that child that's on the street now. They haven't called into the hotline. That first contact with them by the first responders, it kind of sets the stage for everything. And, identifying that victimization, because we can identify that victimization, and Susan was talking about, there's a tremendous amount of resources out there for a child that's on the street. But once we identify that victimization, then we can increase that tenfold now as far as resources for them. But also now we understand where we need to start working. What's going on in that home? Why are they running? So hopefully that answers that question.
Thank you so much. I know that there are so many questions, and I'm reading through them. They're great questions. But in the essence of time, I do need to turn the webinar back over to William and to provide follow-up instructions. But again, from OJJDP, we just thank the presenters here today and just the interest in the webinar and all the questions that have come through. William?
Yes, I'd have to echo that. Thank you all very much for providing your expertise and really for a great presentation. But before I dismiss you all, I just had a few last-minute items. Just remember that you may contact NTTAC. You may contact NTTAC through the website displayed on the slide here. You can stay up to date on the latest information by signing up for NTTAC's TTA listserv. And also, don't forget to visit us on Facebook and like us on Facebook as well. You can also contact OJJDP via the Help Desk by following the contact information on this slide. And as a reminder for folks that the webinar recording will be archived on NTTAC's YouTube page in a few days. And if you like any supporting resources, they can be obtained by contacting OJJDP's Help Desk at OJJDP-TTA@USDOJ.gov. If you all could, please take a few minutes to review the disclaimer here. Excuse me, a few seconds to review the disclaimer here. And lastly, we would appreciate if you could take about 5 minutes to complete the feedback survey. Thank you all again for joining us today. Have a great afternoon. Goodbye.